So I am going to tell you about the layers of the heart. It consists of three layers. From outer to inner there are three layers: fibrous pericardium, parietal pericardium, and epicardium. Epicardium is the visceral pericardium, and the pericardial space is between the parietal pericardium and epicardium. Pericardium is innervated by phrenic nerve, and pericarditis can cause referred pain to the neck, arms, or both shoulders, often left. So this is all about the layers of the heart. As we have studied pericardial, there are three layers: fibrous pericardium, parietal pericardium, and epicardium. Pericardial space is between epicardium, that is visceral pericardium, and parietal pericardium. And there is also two other layers: myocardium and endocardium. So in STEMI, as we have studied, that all three layers are being affected, but in NSTEMI only endocardium is being affected. So this is all about the layers of the heart. So now I will tell you about anatomy of the heart according to first aid. Left atrium is the most posterior part of the heart. So most posteriorly left atrium is present. Left atrial enlargement in mitral stenosis cause Ortner syndrome, and left atrial enlargement can lead to dysphagia, compression of the esophagus, hoarseness of the voice, compression of the left recurrent laryngeal nerve, a branch of the vagus nerve, and it is, as I said, Ortner syndrome. Right ventricle is the most interior part of the heart and most commonly injured in trauma. And left ventricle is the largest part, and it is about 2/3, and right ventricle is about 1/3 of the inferior cardiac surface. As you can see in this X-ray, left ventricle is about 2/3. It is the largest part of the inferior diaphragmatic surface. Thank you so much. This is all about anatomy of the heart. The blood supply of the heart according to the first aid. So it is supplied by left anterior descending artery and posterior descending artery majorly, and right coronary artery also. So LAD is left anterior descending artery, and its branches supply anterior 2/3 of the interventricular septum, anterolateral papillary muscle, and interior surface of the left ventricle. Most commonly it is occluded. As you can see, this is LAD. It is supplying the 2/3 of the interventricular septum, anterolateral papillary muscle, and interior surface of the left ventricle. Then is posterior descending artery. It supplies the posterior 1/3 of the interventricular septum, posterior 2/3 of the ventricle, and posteromedial papillary muscle. This is PD, and it is the posterior surface of the heart. It supplies the 1/3 of the interventricular septum and posterior surface of the ventricle. Then is right coronary artery. It supplies AV node and SA node. Here is the right coronary artery. This is right coronary artery. It is supplying AV node and SA node. Infarct may cause nodal dysfunction, bradycardia, or heart block. Right acute marginal artery supplies right ventricle. And then is dominance, that which arterial supply is more dominant. So there are two types: right dominant circulation, left dominant circulation. That is most important. And there is also one more type, codominant circulation. If a PDA, posterior descending artery, arises from the right coronary artery, then it is right dominant circulation. And if posterior descending artery arises from the left circumflex artery, then it is left dominant circulation. But if PDA, posterior descending artery, arises from left circumflex artery and right coronary artery, then it is codominant circulation. Coronary blood flow to left ventricle and interventricular septum peaks in early diastole. Coronary sinus run in the left AV groove and drains to the right atrium. So what we have studied, that blood supply of the heart majorly comes from LAD and PDA and RCA. LAD is left anterior descending artery, PDA is posterior descending artery and RCA is right coronary artery. LAD supplies 2/3 of interventricular septum, interior papillary muscle and anterolateral surface of left ventricle. PDA supplies 1/3 of the interventricular septum, 2/3 walls of the ventricle, and RCA supply AV node and SA node. Right ventricular is supplied by the right marginal artery. Dominance may right dominant circulation and left dominant circulation. If PD arises from right coronary artery, then it is right dominant circulation, and if PD arises from left circumflex artery, then it is left dominant circulation. Codominant if it is both arises from both left circumflex artery and right coronary artery. So this is all about the blood supply of the heart according to the first aid. Thank you so much.